Hi, welcome to the Anatomy Marathon High Yield Questions. This is Dr. Byson AM. Let's get into this video. So, the first thing that we're going to look at is the posterior triangle of the neck, a very high yield topic. So, this is the posterior triangle of the neck. What you must know is that the posterior triangle of the neck is subdivided into two triangles. It has the occipital triangle and it has the subclavian triangle. This triangle is separated into these two triangles by the inferior belly of the omohyoid muscle. Now remember that the omohyoid muscle has got two bellies, the superior belly and the inferior belly. So what separates the triangle into two is not the superior belly of the omohyoid, but the inferior belly of the omohyoid muscle. And then the other thing that you must know is the contents of the triangle and the borders of the triangle. So the posterior border of the triangle is by the trapezius muscle. So this is the trapezius muscle here. The anterior border of the trapezius muscle. And then the base of the triangle is made by the middle third of the clavicle. So middle third of clavicle, as you can see. So the middle third of the clavicle here. And then the anterior border is made by the posterior border of the sternocleidomastoid muscle. Sternocleidomastoid muscle. So these are the three boundaries of the triangle: the anterior boundary, the posterior boundary, and the base. The apex is by the superior nuchal line there. Now, let's look at the muscles that make up the floor of this muscle. So starting from the superior going to the bottom, you have the splenius capitis muscle. So this is the splenius capitis. And then you have the levator scapulae here. Levator scapulae. Then you've got the miduscalene muscle. So this one here is the miduscalene muscle. Scalene. And then you've got this muscle here, which is the anterior scalene muscle. What we need to know about the posterior triangle of the neck is that there is neurovascular structure that passes through the middle and the anterior scalene muscle, which is the subclavian artery passes through between the middle and the anterior scalene muscle. Also, the brachial plexus, the trunks, not really the trunks of the brachial plexus. So this is the contents of the posterior triangle of the neck that you must know. What we are showing here are branches of the cervical plexus. So cervical plexus. As we go through in this video, we're going to see that the cervical plexus actually starts from C1 up to C4. And you must know the nerves that come from the cervical plexus. So this nerve here, this is the lesser occipital nerve. So when they bring the posterior triangle of the neck like this and they ask you to label, this nerve here is the lesser occipital nerve. This muscle here, we already talked about it. This is the trapezius, and then this is the accessory nerve. This one here is the transverse cervical nerve. It innervates the skin of the neck. Transverse cervical. And then this nerve here that is going to the ear is the greater auricular nerve. You must know these nerves because they are very important. This is the supraclavicular nerves. So these are the supraclavicular nerves. There is the medial, the lateral, and the intermediate supraclavicular nerves. They're very important for you to know. So know how these nerves lie in the posterior triangle of the neck because they are very important. Mostly in the past, they used to bring them this diagram here. This diagram is from Zuckerman, and you must know it. So this one here is the lesser occipital nerve. You know it's going to the occiput. This is the greater auricular nerve. You know it's going to the auricle, to the ear. Then this is the transverse cervical nerve. It's going to the neck. All right. And then these are the suprascapular nerves. You've got the medial suprascapular nerve here, the intermediate suprascapular nerve, and the lateral suprascapular nerves. They are very, very important. It's imperative that you know these nerves. Okay. Then this here, this nerve is the accessory nerve. So know the contents of the posterior compartment. The posterior triangle of the neck is very important. It's a very high yield topic, and it usually comes in exams. All right, let's move on. Let's look at the axillary artery. The axillary artery and its branches is one of the most difficult things students face. But if you get it, it becomes very easy, and those marks become very, very easy to obtain. Let's look at this artery. So the axillary artery has got three parts. Okay. So you've got this part here from rib 1, this is rib 1, to the pectoralis minor muscle. This is part 1. Part 1 is made up of these branches. So you know that the axillary artery is simply when the subclavian artery crosses rib 1. When the subclavian artery crosses the lateral border of rib 1, it changes name from the subclavian artery, it becomes the axillary artery. The first branch of the first part of the axillary artery is a superior thoracic artery. The superior thoracic artery. Superior thoracic artery. And then on part 2 of the axillary artery is found behind the pectoralis minor muscle. You find the thoracoacromial branch, this nerve here. The thoracoacromial branch will give you the clavicular artery branch. It will give you the acromion branch, and it will give you the deltoid branch, as well as the pectoral branch. So these are the branches of the axillary artery. On the third part of the axillary artery, which is the part between the pectoralis minor muscle, the inferior border of the pectoralis minor muscle, and the upper border or the superior border of the teres major muscle. So this here, from there to there, that is the third part. The branches of the third part, they'll give you 3 branches. So it gives you the thoracodorsal artery. So it starts out as a subscapular artery. So it's a subscapular artery. And then this subscapular artery will give you branches like the circumflex scapular artery, and it continues as the thoracodorsal artery. It also gives you the circumflex humeral arteries, both the anterior and the posterior humeral circumflex artery. So what you should know about the axillary artery is that the first part gives you 1 branch, which is the superior thoracic artery, this one here. And then the second branch, the second part gives you 2 branches, which is the thoracoacromial artery. The thoracoacromial artery will branch off into the acromion branch, the deltoid branch, the pectoral branch, and the clavicular branch. The second part will also give you the lateral thoracic artery. Okay, it also gives you the lateral thoracic artery. And then the third part will give you 3 branches. It will give you the subscapular artery, the posterior circumflex humeral artery, and the anterior humeral circumflex artery. When the axillary artery crosses the inferior border of the teres major muscle, it changes name from the axillary artery. It now becomes the brachial artery. So it's very easy. Just go through this video several times and you're going to get it. When it comes like this, make sure you get this full marks because it's easy like that. Make sure you revise it. Make sure you know it. All right, let's move on. Let's look at the cervical plexus. The cervical plexus is a nerve network that is found in the neck. So we briefly talked about this when we were talking about the posterior triangle of the neck. So it comes from C1 and goes all the way up to C4. But you also have contributions from C5. Okay. So it gives these branches, the great auricular nerve, the transverse cervical, and then it also gives the supraclavicular nerves. Remember, we said that the supraclavicular nerve, there is the medial, the intermediate, and the lateral supraclavicular nerves, and they're very important. So it also gives you the lesser occipital nerve. So this is a very important structure that you need to know how to draw. So pause this video, look at it very carefully, know how to draw it, and know how to label it. You also need to know the ansa cervicalis. This is the ansa cervicalis. It runs like this. It forms an arc. So this is the ansa cervicalis. So you see it's forming an arc there. So there's the superior root for the ansa cervicalis, which is that one there, and then there's an inferior root of the ansa cervicalis, which is that one there. What you need to understand is that the phrenic nerve has got its rootlets, its origins in the cervical plexus. So the phrenic nerve comes from C3 up to C5. So phrenic nerve, C3 up to C5. Those are the contributions to the phrenic nerve. This is a very important structure that everyone has to know. Make sure you know it, draw it, make sure you answer it if it comes in your test. All right, let's move on. And let's look at the brachial plexus, a must-know plexus that is very high yield, either in MCQ questions or in diagrams. So the brachial plexus comes from C5 through T1. So C5, C6, C7, C8, T1. So these ones here are the roots of the brachial plexus. Let me use red. So these are the roots here. So roots C5 and C6 will join and will form the superior trunk. This is the superior trunk. And then root C7 will continue as the middle trunk. C8 and T1 will form the inferior trunk. And then these trunks will divide into divisions. So each trunk will divide into the anterior and the posterior division. Anterior, posterior, anterior, posterior division. These divisions are then going to fuse to form chords. So the anterior divisions of the superior trunk and the middle trunk will form the lateral chord. So this is the lateral chord. And then all the posterior divisions will form the posterior chord. Then the posterior division of the inferior trunk will form the medial chord. The terminal branches of these chords are that the lateral chord will give the musculocutaneous nerve, and then it will give a branch which will fuse with another branch from the medial chord to form the median nerve. Form the median nerve here. And then the terminal branch of the medial chord will form the ulnar nerve. It will also give other nerves like the medial pectoral nerve, the medial cutaneous nerve of the arm, and the medial cutaneous nerve of the forearm. The posterior chord will give the axillary nerve, and it will give the radial nerve. Other branches that will come from the posterior chord are the upper subscapular nerve, nerve to the latissimus dorsi, which is the thoracodorsal, and the lower subscapular nerve. So other branches from the brachial plexus are that from roots, the upper trunk, you find the dorsoscapular nerve, and then from the superior trunk, you find the suprascapular nerve. Okay, so these are the only two branches that come from trunks. The superior trunk is the only one that will give rise to branches, the dorsoscapular nerve and the suprascapular nerve. Root C5 will also contribute to the formation of the phrenic nerve, as we saw earlier. Emphasis: the brachial plexus is very important. All the nerves of this plexus must be known, and you must be capable of drawing it, labeling it at any particular point. Questions for this plexus, you find them in the MCQ and in the section B for drawing or labeling. All right, let's move. Let's look at the Capotanel. So, question is, draw the Capotanel and all its contents. This is the Capotanel. Okay. So the Capotanel is bounded by the transverse carpal ligament, which transforms the carpal arc. This is the carpal arc here, like that. So that is the carpal arc. The carpal arc is made by carpal bones from lateral to medial. You have the trapezium, the trapezoid, capitate, hamate, tracheatrium, and the pisiform. So this is the carpal arc. This is a carpal arc. It is made by these carpal bones. And then what transforms the carpal arc, this carpal arc here, into the Capotanel is this ligament here. This ligament is what we call the transverse carpal ligament. So this is the Capotanel. What are the contents of the Capotanel? You've got the flexor digitorum profundus tendons. These are 4. And then you've got the flexor digitorum superficialis tendons. These are 4. You've got the median nerve, 1. And then you've got the flexor pollicis longus tendon, 1. And then you've got the flexor carpi radialis tendon, 1. So you've got about 11 things that pass through the Capotanel. You've got 11 things. You must know how to draw the Capotanel, and you must know the tendons of the Capotanel. Capotanel syndrome is compression of the median nerve. So compression of this nerve here, the median nerve. When you compress the median nerve, what is going to happen is that you are going to have thinner wasting. So Capotanel syndrome comes with thinner wasting, meaning these muscles that are found here on the base of the thumb will start shrinking, thinner wasting. You also start having pain in your hand, tingling sensations, and weakness. So that is very important for you to know the Capotanel. Extremely important for you to know the Capotanel. So these are the extra diagrams that I have added for you. Now, the question that you find in your MCQ is this: what muscle, what tendon passes above the flexor retinaculum? So it is the tendon of the palmaris longus muscle. Palmaris longus muscle. So the tendon of the palmaris longus muscle won't go through the Capotanel, but it will pass through. It will pass on top. Like here, let me show you here. It will pass on top. So this is the tendon here, palmaris longus tendon. It will pass on top of the Capotanel and it won't go through the Capotanel. It's very important that you know this cross section Very important that you know how to draw it. All right. Okay. So that is an additional picture that I've added there. The hermit, the capitate, the trapezoid, and then the flexor retinaculum, which is the transverse carpal ligament that will change this tunnel into this arc, carpal arc, into a tunnel. Capotanel is very important. Now let's look at the hand, the last but not the least, the hand. These are the muscles of the hand. Most people do not pay attention to the hands, but it usually comes. So the hands, this is where your thumb is, this side. This is where your pollex is. The pollex is the thumb. So these are the muscles of the hypothenar eminence. So you've got the opponens pollicis, the abductor pollicis brevis, which abducts your arm, the flexor pollicis brevis, which flexes your arm, and the adductor pollicis, which adducts your arm. The rumbricals are responsible for fine movement of the fingers, and they are inserted into this here, which is called the extensor hood. Extensor hood. All right, and then these are muscles of the hypothenar eminence. So this, it contains the flexor digit minimi and the abductor digit minimi. Abductor digit minimi. You also have the adductor digit minimi here. Okay, so that is called the adductor digit minimi. It's very important that you know the muscles of the hand, because this diagram usually comes. The cubital fossa. This is a cubital fossa. So the cubital fossa is found on the anterior elbow. You must know the boundaries of the cubital fossa and the contents of the cubital fossa. So the boundaries of the cubital fossa, on the lateral aspect, you find this muscle here, which is called the brachioradialis muscle. So the brachioradialis. The brachioradialis. And then on the medial side, the boundary is the pronator teres. The pronator teres muscle. And then the base is an imaginary line between two epicondyles, the elbow epicondyles, the humeral epicondyles. The contents of the cubital fossa are very easy. So from medial to lateral, you've got the median nerve. This is the median nerve here. And then you've got the brachial artery. So when the brachial artery enters the cubital fossa, it divides into the ulnar and the radial artery. And then you've got the tendon of the biceps. Okay, so the mnemonic is nerve, artery, tendon, NAT, or MBB. Median nerve, brachial artery, and biceps brachii tendon, MBB. There's also, you find the deeper branch of the radial nerve. So deeper branch of the radial nerve. So others, the mnemonic is just MBBR. So the MBBR is the mnemonic for the contents of the cubital fossa, the median nerve, the brachial artery, tendon of the biceps brachii, and the deep branch of the radial nerve. It's very important. Very, very important. So when we look at the roof, you also find this vein here on the roof of the cubital fossa, which is called the median cubital vein. The median cubital vein will communicate the basilic vein on the medial side and the cephalic vein on the lateral side. So these communicate like this. They form an H. They communicate in the cubital fossa via the median cubital vein. You know, this cubital vein, the median cubital vein, is very important for IV access and also for drawing blood in a patient. Very, very important. So you must know these contents of the cubital fossa. So that was the high-yield scenario questions that come in anatomy. Go through this video over and over and make sure to understand. All the best in the test. The next video will be on the MCQ questions that come.